Hello everyone, I am Dr. Sudhir Srivastava, Cataract and Refractive Surgeon, Head of Sanai Group of Eye Hospitals at Lucknow. I welcome you all at Sudhir Eye Coach, the channel which is dedicated for budding and emerging ophthalmologists. Today I'll be showcasing a case of non-dilating pupil with fibrosed pupil along with the posterior synecdoche. In this particular case, because the nucleus was not very hard, hardly grade 3 cataract, and pupil was also uh, sufficiently moderately dilated. So after creating a side port incision, I filled the chamber with viscoelastics, then I released the posterior synecdoche, and with the two uh, iris repositor, I stressed the pupil, and the pupil becomes sufficiently dilated, and it becomes central also. So rest of the surgery was like a normal case. I created moderately sized, sufficient size of capsular axis, did decent phaco fragmentation without problem. Only problem in such cases is that the iris, because of the chronic inflammation in the past, it becomes slightly flabby and less and becomes flaccid. So sometime if you go closer to the iris, then you may catch hold with the tip. So always do it under proper visualization and do not bring your phaco tip closer to the iris tissue. So I finished this case without any kind of problem. So just watch the steps carefully, and if you have any comments, you can put it in the comment box. Enjoy the video and thanks for watching.